World Occupational Therapy Day is observed annually on October 27 to promote and celebrate occupational therapists around the world. This year's theme is Belong, Be You. But what is occupational therapy? Occupational therapy is the use of particular activities that help to restore functionality from physical or mental illness. Occupational therapy is not new to the world, neither is it new to Ghana. In 2017, the course was introduced to the University of Ghana. Outside of that, 5 graduates of the course in 2019 conducted a workshop with the country's 68 rehabilitation assistants, helping them to hone the skills that they would have already acquired over the years. Since then, the profession has made huge strides in the country. Occupational therapist Zoe Daniels, who is attached to the Regional Special Need Disability Diagnostic and Treatment Center located in the compound of the Cyril Potter College of Education, share her thoughts on this year's observance.
So basically this theme, and I love this theme because for me, it is where we're putting the persons with disabilities on a independent level. So for the part belong, right? It still shows that you belong in society and you belong here. And be you.
The Regional Special Need Disability Diagnostic and Treatment Center is as a direct result of discussions at the 4th CARICOM Cuba Summit 2011. After a few similar meetings, the first batch of persons were trained by Cuban specialists, and subsequently the doors of the center to stimulate children, youth and adolescents with special education needs associated with disabilities was opened in January 2018. Now, how can you recognize when someone is in need of occupational therapy? Here are 5 signs that may indicate when someone is in need of occupational therapy. Changed health condition. Recent surgery, significant illness or mobility changes can all create a need to learn new ways to maneuver around one's home. Minor falls or balance issues. If someone has fallen recently, this can be cause for concern. Falls are the leading cause of non-fatal and fatal injuries. Growing concern about independence. If someone is wondering if they have the skills to be independent, then they are urged to consult a therapist. Lack of hygiene. If basic physical upkeep has become increasingly difficult for someone, then they are urged to consult a therapist. Lack of interest or memory problems. Occupational therapy doesn't just teach physical skills but mental ones as well. This could be beneficial to people who suffer from mental changes. If you have noticed these signs from a loved one, occupational therapy can help. The Diagnostic Center has a wide range of services that can help the rehabilitation of patients. Some of the services include ergonomics, geriatric, pediatric, and mental health. These services enable patients to be functional in everyday life. Alex Kurt, the father of a 7-year-old boy living with autism, told the DPI that his son has been receiving treatment at the center for over a year. Over the course of time, he has recognized major improvements in his son's behavior.
If you know anything about autism, you would know that persons diagnosed have difficulty with doing the everyday thing for themselves, like self-care, writing and so on. And the center has really helped him in that area. We have seen a tremendous improvement in his self-care in terms of him being able to dress himself, to go to the washroom whenever needed, to pull down, pull up, basic day-to-day functions.
Parents, guardians, and caretakers of patients receiving treatment at the facility are also offered guidance and advice on how to assist their loved ones in the absence of a therapist. For persons requiring access to occupational therapy services, here are a few places to contact: the Regional Special Need Disability Diagnostic Treatment Center, Ptolemy Reed Rehabilitation Center, Georgetown Public Hospital Corporation Rehabilitation Department, the West Demerara Regional Hospital, and the PALM's rehabilitation services.